Welcome to Wayward Writers. I'm senior literary agent and author Heather Cashman.
I'm author and writing coach Stephanie Bearce.
And I'm author and writing coach Nicki Jacobsmeyer.
Our mission is to nurture and enrich established writers throughout their publishing journeys.
We welcome all genres, age groups, and publishing paths through video podcasts, online webinars, in-person retreats, and more.
We're here to help you conquer your path.
Hello, everyone. We are excited today to be talking to Dr. Cristie Ritz King, who is an expert in trauma and maternal mental health. And we're excited to chat with her today about writing authentically with mental health issues. So, Nicki, can you tell us more about Cristie?
I'd be honored. So Dr. Cristie Ritz King brings the courage of resilience to the world, using her expertise in trauma and maternal mental health to support women through life's deepest transitions. As the founder of Wonder Inc. Wellness and the I Wonder podcast, Cristie embodies service and safety by guiding others to embrace both trauma and triumph, grit and grace, so she can help them not just survive, but thrive with strength and purpose. That gave me chills. Thank you so much for being here.
It's beautiful.
Thank you. I'm so excited to join you guys. It's my favorite thing to talk about.
Yeah. Oh, good. That's great. That's great. So I guess I first want to say just to our listeners, this is kind of a side note, but one of the important things about writing is networking, meeting people, and sometimes getting uncomfortable. And Cristie and I, this is the first time we've met, but I reached out to her through the network of my alma mater through my sorority. And I guess what I want to say to that is that sometimes we have to leave our house and put our pants on and talk to people, and that can be uncomfortable. But I just really encourage everyone, if there's that person that you'd like to pick their brain or connect with, the worst they're going to say is no, and just reach out. And Cristie was so enthusiastic, and I just appreciate that our bond and being the same sorority has lasted for many years. We don't need to say how many since we graduated, exactly. But we were able to share that connection. And I think that just speaks to mental health also, that even as introverts or extroverts, we have people, right? Community connection and things like that. So it really means a lot to me and Wayward Writers that you're here. And first, we wanted to see if you will share your journey on how you found this fulfilling career in mental health and what services you offer to folks, women specifically.
Yeah, it's turned out that way. Sure, I'm happy to. And it's a journey, let me tell you. I was for a long time a teacher. I have a master's in education and was a reading specialist and an 8th grade English teacher. Mm-hmm. And at my heart and core, I am a writer. So that is what I was doing when I had a bunch of kids. I stayed home and did some freelance writing and blogging when that was a new thing. Giving away my age, I was, one of the first mom bloggers. We kind of created that title. And then so I was working in the parenthood space. I never went back to teaching, but I got trained as a doula. I got trained as a holistic health coach, and I was working with parents feeding their kids and trying to have dinner time that was drama-free and all of that stuff. And I live on near the Jersey Shore, and we had Superstorm Sandy, which decimated, much like Milton and Helene that just hit in North Carolina and the southern part of the country. We had a similar situation, and I spent a good deal of time after our immediate crisis. We kept our house, but we lost power for a few weeks and had to do all the water and ration, that kind of stuff. So once that was over, I spent a lot of my time helping with the recovery efforts in the towns that were wiped out. And I thought to myself during that time, like, who's helping these volunteers? There was all this wonderful help for the people that were experiencing the trauma, but there wasn't anybody to help the people who were then going from this trauma back into their regular lives and trying to live a regular life. And that really kind of stuck with me. And so I had been toying with going back to graduate school anyway, because of the work I was doing with health coaching there's a lot of trauma involved in health and weight and diet. And so I felt unprepared anyway, and it all coalesced, and I went and got a master's in mental health counseling and then just stuck with it. And through that, trauma, specifically with trauma and crisis as a specialty, through that got involved with a women's shelter, domestic violence shelter. I was a court advocate for sexual violence survivors and spent a lot of time around kids and parents. And so continued on to get my doctorate with a focus really on maternal mental health, postpartum and beyond. So I say I found myself working with women because I didn't set out to do that. I thought I was going to go help first responders and trauma people who are involved in crisis of trauma. And I just found the penchant that I had for kids when I was a teacher translated into helping their parents understand how to parent and to stay true to who they were in that process as well. As any parent will tell you, it's not an easy task. So that's where I am today. And the business name Wonder Inc. comes from this idea that no matter how we find ourselves in the weeds, if we try to spot the wonder, if we stay curious, if we look for those moments of awe, then that can be really helpful in the healing process. So I stick by it. Even in all the trauma, I stick by this idea of wonder being available to us.
Oh my goodness.
Wow.
Thank you
I love that
so much. Sorry, I'm getting clumped because as our listeners know, I struggled with postpartum depression with all 4 of my pregnancies, and I wish I had you 18 years ago. And I think it's just such a blessing what you do, and that your path, like just how it weaved and went in different directions, and you walked the path that you weren't certain about. So thank you so much for what you do and being here. And
I wish I was around for you 18 years ago too. And I struggled too with it after my first. And so undiagnosed, unassisted, but later realized, oh, that's what that was.
Yeah.
So
right. When I think at Wayward Writers here, we try to get frequently guests that talk about mental health because it's so important. And I think it's much better, but I think there's still a stigma talking about it. And 100%, and pride and things like that. And so I think it's great. It's a huge part of writing or in everyone's world, but something that's such an isolating craft. So thank you.
Yes, of course.
Yeah.
Yeah, one of the things I loved most about the days of blogging was the community. We were all these moms home, like you said, home and isolated, but we found each other online. And it was the most beautiful and authentic place. It is not anymore, but it started out as this kind of beautiful and authentic thing. And some of those women are still my closest friends to this day. So there's power in that vulnerability if you can build community around it.
Absolutely.
So.
Well, I'll reach out to you later.
Yeah.
Let's get talking
for sure.
Let's get talking about how we can portray this authenticity and this sensitive subject on the page. So
yes. Yeah, I loved that you guys reached out about this. Personally, I loved it because I am a reading geek and, aspiring writer, as I say. I'm a writer, but not fiction. So I can't wait to dive into this. I have plenty of thoughts.
Okay, so we all know we do need to be very sensitive and careful when writing someone that has a mental health diagnosis. Can you give us some general pointers in how to write authentically and with sensitivity?
Yeah. So the very first thing I thought of was that this should be how we behave in the world anyway. And that is that you are not your diagnosis. And very often your diagnosis is a very small part of even who you are in the day-to-day. It's a part, and it is a piece that can affect a lot of things, but it isn't who you are. It's not your label. It's not your personality. It's not any of those things. And so in writing about it, to be truly sensitive to the person, I think keeping that in mind, that this is a part of their story, but it is not their story. And it isn't even necessarily the driver of their story in a lot of ways too. And so it was how you write about it is how we really should be in the world with it. And understanding that these diagnoses are pieces of us, but not all of us. And also the diagnosis itself, there's some gray area there in a lot of ways now. You talked about the stigma. Again, as a trauma therapist, I'm trained a little bit differently to look at things from that lens, like what happened to this person versus what is this person's diagnosis or disorder or whatever other word you want to use. Now, the world of mental health and insurance and everything else still demands that I give them that number on their paper, but it doesn't necessarily inform my treatment as much as one might think either. And I don't think it informs many people's day-to-day life as much as maybe we think it does too.
Yeah.
So what are some common pitfalls or misconceptions, like stereotyping, that writers just living our lives in society should avoid when creating characters with mental health issues?
I think maybe the trickiest part might be, and again, as somebody who hasn't done this, I don't know, but I would wonder if the trickiest part would be you want to write about the mental health piece because you want that to be important. It's important. Let's put it that way. It's an important thing to write about. So you want to be that way. So then how do you do that and not lead with it? I guess is the same way I think you want to write any good character, which is that they are a 360-degree human. So what are the pieces? So rather than getting caught up in the trope of I am a bipolar person or I am a this or that, like instead of going to the extremes of the diagnosis, maybe concentrating more on how does a person live with this diagnosis. So instead of researching what it looks like to get this diagnosis, well, instead, what is it like to actually live? Who is someone out there living with this diagnosis and who looks like everybody else? And so to me, that's the more authentic human thing, is that there's people walking around all over the place with diagnoses that we would never know. And I think that's important to write about. That it's not like, oh, I got this bipolar diagnosis or I have this schizoaffective diagnosis and my whole world is that. Instead, it's how do I have a whole world while still having this diagnosis? So that would be the sort of caution, is to not let it lead the story, but have it be
it's like it informs the story, you know?
Yes.
The character might have choices or thoughts if it's in first person that might be influenced by whether it's diagnosed or not, you know?
Exactly.
And that's the reality of all of us with any situation, not only like diagnosis, but like trauma. You might not have a diagnosis, but if you experience something, it can change you. And it's something to definitely think about and evaluate when we're writing.
Yeah.
So it sounds like what you're saying is treat it just like any other character trait that they would have.
Yeah. And look into, well, what does that mean then? If they're, I don't know, if they're type A, you sort of know what some of the behaviors might be. If they have this diagnosis, what are some of the behaviors, or what are some of the day-to-day problems and issues they face as a result of it?
Right.
How does it work?
And do your research and talk to real people.
Yes. Yeah.
About it.
Well, and don't you think, I mean, obviously you think this is what your doctor does. That's the part that, like, the psychology of what's happening, what that person thinks. Because sometimes, right, even though the diagnosis or symptoms don't define that person, there are some days that they feel like they define you, right?
For sure.
And what does that look like? And these misconceptions of even things like, I mean, I know we're going dark, but we're talking about mental health, which can be like suicide. And if that's not something that you're familiar with, it might be like, oh, well, that is a selfish act. But if you talk to someone that has been there, they feel like it is the most selfless act, that they are helping the people around them. And that transforms your character. And it's not just what we see, but what are they internally struggling with, and the great things. Like, some people find freedom in a diagnosis, or being like, you are not alone, especially as a mother, right? You are not alone, or as a woman. And so it can be both positive and negative instead of just negative, don't you think?
100%. Yeah. I think suicide's a good example because there's so much more to it than that final act. And we never talk about that, good or bad, the surviving of it, the thoughts of it, all of that. But, and same with the diagnosis, there, as you said, there can be great relief in knowing like, oh, this is it. There's not just something quote unquote wrong with me. This is the thing that I now can learn how to manage.
Right.
It 100% can be freeing. And I also think not necessarily that it's a negative thing, but we as a society have made it a negative thing by turning it into a definition of somebody. And I'm really thinking of the bipolar and borderline personality and narcissism and the things that you see thrown around now all over the place as diagnoses. Even OCD to some point, we use that as a way to describe people. And if you don't have a true understanding of what it means for someone, we all have tendencies for all of those things. We've all got narcissistic tendencies. We've all got OCD tendencies, things like that. But that's different than somebody who's been diagnosed and is living with this thing that can consume them or doesn't have to, depending on the stage they are in it. So I think, keep being sensitive to that, understanding that diagnoses aren't everything, but also they can be freeing for some people too. I also think there's so much, again, as a trauma therapist, there's so much out there that isn't a diagnosable. It's not in the DSM, but it still really affects a person's lives. All the patterns and behaviors that come from learning things that we needed to along the way to develop and thrive and survive. All of that sometimes is a little more prevalent than an actual diagnosis as well. So things that, like in kids, things that look like ADD really sometimes are trauma responses or are behaviors that they learned in order to keep themselves safe in some environment. They show up looking like this in another environment. And relationship patterns that we learned from maybe a messy childhood that act out in our adult lives. There's so much more to mental health than just the diagnoses that we might carry, that I think it's a rich place to write characters and to talk about characters' day-to-day struggles or triumphs when they notice patterns and notice behaviors and things like that.
I just had a couple thoughts while you were talking, which one is that we need to also be realistic about, if there is a diagnosis, how other people treat them and what they do and how that can affect your character like authentically from the character's point of view. And how much just really truly you need to research and talk to people who are living this, because I also think that this was my second thought. Two people who have the same diagnosis with completely different backstories and loads of other characteristics are going to react like totally differently to the same stimulus. Again, it's what you were saying. It's the whole person. You have to take the whole person into account, right?
Yeah. And the sort of before and after too. Like, where did this come from? Again, I have such a trauma brain that I don't always think in diagnoses. I think more of like behavioral patterns and and triggers and all of that kind of stuff. And so where did this come from? Why is it here? And then what are you going to do with it? Like, how does the rest of your life happen once you've identified this stuff or see this stuff?
Well, and what you just said, triggers, those are fascinating. I mean, something that is a simple sound or smell or even a good thing to one person can be the demise of another, and how that on the page could bring so much.
And even the discovery of it for yourself, because they can be anything. We've all seen the scene on TV where the ceiling fan makes the soldier think of the helicopters or whatever. We've all seen that, but they don't have to be that big. They can be I smelled my mother's perfume in the Macy's and I started crying because I've just lost her a couple years ago, or something to that effect. I'm acting like that's not a personal story. It's 100% a personal story. But my point is, I didn't even know at that time that's what was happening. Like, what am I crying in the Macy's for? It's because somebody just squirted her perfume in my face. And so learning that about yourself, every time I hear this song, I'm going to burst into tears, or every time I'm going to get anxious because this thing happened when I saw this or smelled it or whatever. So a character learning that through the course of a story, like learning their own stuff, can be really fascinating too. But as the writer, either it's your personal experience or you're learning from somebody how it played out for them too.
Well, and what a great way to show a character arc too, because they could have that trigger happen the first time, figure out what it is, and then the next time that happens to them, you see how they've changed because they've grown, or maybe something worse has happened. But like, it would show like a negative or positive character arc. I think that would be an interesting way to do that.
There is an author, Abby Jimenez, who I really enjoy reading because she does that well. She does human trauma well in the sense that her characters realize as they're going, either they come into the story knowing like, yeah, these are some things I'm not going to get right because of my background, or they realize it as they go through. And then what I love about her as a human is that she makes sure it's all wrapped up at the end. Yeah. Like they come back and there's a happy ending, which I love, because I do think that's possible once you recognize your own stuff. And oftentimes I just finished one of hers where the woman literally went away and worked on it. It was like, I can't be in a relationship until I go and figure this stuff out, and then came back. And that was very satisfying. It's a little neatly tied up with the bow at the end, but I kind of like that sometimes.
Well, yeah, I'm a huge Abby fan too, and I've read all her books, and I enjoy romance, and she's a great romance writer. She also infuses the humor, but what I loved and what you're saying is it's more than just a love story. Like she dives into those topics that you're changed after you read it, whether it's something you've experienced personally or that you've been informed about to be more sensitive and kind and mindful to others. So
of what's going on. Yeah, I like the way she does it. And as a couples counselor, I love Emily Henry, the way that the couples actually talk to each other. I think sometimes as writers we can, and I'm speaking now as like a reader of a bajillion writers, but I think sometimes you don't want to say the stuff out loud. You want to either infer, because as humans we do this too. You just assume things about someone, or you just assume things about yourself. And I appreciate when, as again, with my psychology hat on, I appreciate when writers do that, when they show this ugliness of human relationship when you're being honest and authentic with each other. Mm-hmm. And notice a lot about yourself in the conflict too. So I think that's a way to move the story forward sometimes too, is the conflict, and then they have to go away and figure out why that just happened. I think there's a lot of richness there that can be explored through it.
Yeah, and grow from it. Yeah. Right. Yeah. Instead of just running away from it, which is much easier to do, right?
Yes, and there's plenty of books like that.
Yes, absolutely.
Yeah.
Can you share insights on how mental health struggles might realistically influence a character's motivations and relationships and responses to conflict?
Yes. Yeah. Ooh, that's a rich one. I think one of the things that realistically might happen too is that a person isolates. I think there's a lot of, I don't know how to be in the world now that I have this happening. And so interacting with people has become much more difficult. Other people might think things of me that I don't want them to, or do I share this with people or do I not? I think there's a lot of identity work that needs to be done around a diagnosis when somebody gets it, or even just around recognizing sort of trauma patterns and responses. There's a lot of identity work that happens that a person goes through that could affect their relationships, affect their job, so I think there's a lot that you dug into there, is how does the person interact with the world with this diagnosis? What do they expect from people? Do they expect they can't share everything? There's a lot there too. What was the end part of that? Because there was something else I wanted to say.
Responses to conflict.
Oh, yeah. So this is response to conflict is my whole job as a trauma therapist, because those are the patterns. Typically, when we talk about trauma responses, we talk about the patterns that you've developed over time to survive whatever it was you're coming from, whether it's a childhood that you needed more than you got, or a relationship you were in where it was toxic or whatever. We as humans create ways of behaving in order to get through those things. And then they show up in other relationships, and that's not always great either, but we're also not always aware of it. So we talked a little bit about developing character. I think there's an amazing way to do that with, how am I showing up? Why do I keep fighting with this person? Or why can I not make relationships work? Let me examine what I'm doing on my end, or what I need to stay away from on their end. And how do you move through that? So I think trauma specifically, and mental health, as far as like a diagnosis in there, a lot of times you get diagnoses based on trauma responses.
Yes.
So I have many clients over the years that have come in with a written diagnosis because they ended up in the hospital at some point. And then we realized through unraveling a whole bunch of stuff, it's actually not that. It was that in the moment. It was a psychotic break, or it was a breakdown, or it was an anxious or a depressive episode. But now that we've unraveled some of the trauma and healed some of that, it's different going forward. And frequently that is in relationship with a partner, in relationship with a boss, in relationship with your children, is where you discover a lot of that stuff. So I think that is a rich area to be able to explore and write about human development through that lens.
I'm sitting here thinking about what you do and all the people you help. And then I'm thinking, how do you personally compartmentalize that? And this even speaks to those of us that want to write about someone that is a psychologist or someone that does therapy. How do you do that?
Yeah. Well, I think one thing that has saved me is that I didn't get into this until I was much older. I think if I had started this at 25, right out of college, I would not be healthy. I'm just being honest. I would not be mentally healthy. So prior to going, I did a lot of work. We spoke about, I had postpartum depression. I lost both of my parents young. Like, I did a lot of work of my own early on. I also married a guy who's both of his parents are mental health professionals. And
wow.
There's a lot of talking about feelings in our house. And I knew that I had some patterns I wanted to break as a parent. I had wonderful parents, but it was a different time. And so I knew that I wanted to do things differently with parenting. And so I did a lot of work there. So I came into this really aware of my own stuff. And that's helpful. Also at an age where I understood the importance of taking care of myself. That like I couldn't take on. My husband, even when I remember going into this, I came out of being a classroom teacher. And part of the reason I stopped that job is because I was like, I'm having trouble having my own children and these 30 children that I care so deeply about. And so when I went into this field, he was like, I have to be honest, I'm a little worried that you're not going to know how to turn this off. Like you carry like the grocery ladies stuff around in your heart. How are you not going to carry these people?
That's a fair question.
He had every right to ask it. And so I really had to proactively concentrate on how to take care of myself. And I would love to say that it works all the time. It doesn't. There are times where I realize I'm completely off the rails and I need to go take a week off or something. But in short, I just check in a lot to my own self. I'm a voracious reader, and it is never anything that's too heavy. It's rom-coms. It's well-written rom-coms, I have to say. Some of the like mass-produced stuff is a little much, but I read a ton. I watch a ton of television and not reality, nothing like that. Again, well-written. Anything that's well-written is like my escape into that world.
Yeah.
And then just time with people that I love. I have 3 almost grown kids now. And so anytime I can get them, it's great. And I made an effort because I would much rather sit on the couch and watch TV, but I know that I am helped by getting out into the world with people too. So getting back to that. But it's an effort and it's not consistent. And I think that's also out in the world now more too, not only how we all have to take care of ourselves, but how therapists have to take care of ourselves. So we're pretty good about checking in on each other too. Generally speaking, on the internet, we're pretty good at checking in on each other. So I think that's helpful too, is that everybody recognizes like this is a big job and we need to make sure we have enough left over for ourselves too.
Yeah, it's like the whole airplane thing. Put your oxygen mask on first before
exactly.
The person next to you that you're traveling with. So
yeah, and it can be really difficult because this, especially in trauma work, because sometimes you're working with people who really, like, if you take a week off, that can be really jarring for them. And so understanding that enough to know, okay, here are some other supports and I got to turn my phone off, and being really clear with them that, so I'm also really clear with my clients that what my boundaries are too, which I think is sometimes helpful for them too, because most people don't come to me with very good boundaries. So if they can see somebody else practice them and learn how that is, it's good too.
That's fair. I feel like that's probably common in any professions that are like of the helps.
Yes.
And on an emotional level, I think of agents and editor, you know what I mean? Like they're there to help someone else. And I think sometimes it's easy for us to forget that they're a person too. They need the boundaries in order to successfully help us. And so thanks for saying that.
Yeah. And I think writers too, if you're going to do it well, at least this is my opinion, but if you do it well, you are immersed in those people and their lives and the stories that you're telling. And so planning time away from them, whether it's in the middle of it or whether it's when you finish, because that's just your process, is I think important to cleanse your palate, if you will, of all of their stuff. You can put all their stuff down.
So we were talking before about the fact that a person has many, many characteristics, and one of those characteristics would be their culture. So are there ways to respectfully include cultural nuances in a character's mental health journey?
For sure. Well, I think doing it is the respectful way. And this goes back to your point earlier, Heather, about talking to people about it. Certainly I can't write certain cultural, as a white woman, I can't show up and talk about what the journey is like for somebody that isn't a white woman. But if there is a character involved and you want to speak to that person, or firsthand, or you are the person, that I think is the most important part of it. Is so the short answer is yes, there are always cultural implications when it comes to mental health, whether it's the systems that are in place that cause the trauma, or whether it's just the way you respond to mental health in your culture, or have up until this point responded to mental health in your culture. There are always cultural connections with mental health issues. And I think it's really important to have first person knowledge and or speak to someone who can give you that first person knowledge of it.
Yeah. Well, even if you're writing your story, there are going to be other people in your story who aren't your culture or who aren't your exact situation. And I can even just think of the culture of my own personal family is very different. I mean, how I was raised with my grandmother and my mother and my aunt. And my aunt had a child who was my cousin, but she was like my sister. But we had a very interesting culture in our family because it was so matriarchal. And I think that that's a very small thing, but it shaped a huge part of who I am. And so I guess we just need to do that research and talk to people who have these kind of situations.
Or say it out loud. Like that I don't think that is such a small thing, that you were raised in this sort of female dominated culture, if you will. And I think sometimes, like, I was maybe talking about the big C culture, like where are you from? What are your traditions? That kind of thing. Whereas it sounds like yours is more that small C of the environment you grew up in or live in currently or whatever. And I think that plays a huge role in mental health and resilience and even just point of view on things. That I talk about, my company name is Wonder because I have this insatiable, curious, and this idea that if we just try to find the bright points, it can be helpful. That's 100% from my mother. That I wasn't born that way. She fed me that. And so I think as a writer, just acknowledging that that's part of who you are. It may not be an officially diagnosed thing, but those patterns and behaviors come from that culture that you were raised in, for better or worse, you know?
Yeah. Or sometimes both.
Exactly.
And what a wonderful way, Cristie, just to honor your mom. And she'd be very proud of you. And I bet that would make her happy to know that, especially as moms, we're always wondering, are they listening? Are we, is what I'm saying just going through? So that's really, really neat.
See anything we're doing?
Right. Okay. So on the, ethics side, what ethical considerations should we as writers keep in mind when we're portraying mental health issues, especially when we're drawing from real world experiences from people in our lives?
Yeah, I think that's the tricky part, is if they are real people in your lives, is it your story to tell? I think making sure you have full permission to use. That said, your experience with that, if there's someone in your family that's an addict or something, their story isn't yours, but your story as the family member of an addict is 100% your story to tell. And so ethically, that's fine. And then as long as you're sensitive to how you portray that person, I think. But as far as the ethics are really for the therapist. So as far as the writer goes, it's more sensitivity than anything. You're not holding anybody's secrets. And you're telling the story from your point of view. Maybe knowing what the ethics are for a therapist, if that's part of your story, that's important. But if it's not, then again, as long as you're treating them like humans in your writing and looking at the whole person rather than writing about them as if they are their diagnosis, then I'm not sure there's any ethical lines you could cross.
Well, and everyone's experience is so different. I mean, yes, I'm sure there's consistencies with a diagnosis with addiction, but one addict is different than another,
Absolutely. Yeah.
Interesting.
And I think maybe we talked about this already, kind of falling into some of the tropes or the stereotypes. The addiction is that's a minefield for not falling into tropes and stereotypes. And again, I think that's where my trauma brain kicks in, which is that nobody is born that way. There's stuff in their lives that have happened to them and it results in this. And so I don't know if it's ethical or just human, but looking at that person as who they are rather than as a sum of the behaviors that they've displayed can provide more sensitivity in the writing of it. If these horrible things happened as a result of their addiction, don't shy away from that, but also that isn't because they're a bad person or because they are damaged or broken or whatever the sort of trope is for people with any kind of either addiction or mental health issue. This idea that there's something wrong with them or that they're broken, that I would stay away from and really just recognize it as part of a whole.
I think about the villains of my own story based on the people, or maybe based on people I know of who hurt other people that I cared about. It's hard not to see them as just the villain.
Yeah.
It's really hard.
Yeah, it is both in writing and life. I think some of the work that I do with folks is helping them, for their own sake, find compassion, because not to forgive and forget, that is a trope that I don't stand behind. I think if someone harms you, you don't need to ever forgive or forget them. But somehow what I've witnessed is that seeing a person for who they are, wholly, it makes it easier then to actually not make it about you. So if the villain is somebody who actually probably had something happen to them at some point in their life as well, then it's no longer about, it's their problem, not yours, and not something you could have changed or done differently or whatever. So you get to release them from it. But you're right, writing them more than that sort of one-dimensional villain is tough. It's a tough thing to do.
Yeah. It is necessary, though, because you want your villains to be real. Okay, I'll tell you something that I see a lot in my query inbox, which is a lot of people propelling plot or telling things or just like info dumping using a therapy session. So do you have any suggestions for other ways that writers can move things along without the therapy sessions?
Yeah, I loved this question actually too, because I always wish that they had a therapist on whatever those books and shows are talking about what a therapy session really looks like. If only we had all those amazing realizations in one therapy session.
And all those amazing couches, right? Yeah. That's what I think. Like every time I see one, I'm like, wow, you're taking a nap. I've never experienced that. That is one plush duvet.
Yeah, I was just gonna say the most beautifully decorated spaces too. Yeah, I'm like, where's all the Wayfair furniture? The $7,000 leather couch. Yes, I love those.
I went to Freud's house in London, and I'll have to say he does have a very nice therapy couch.
I know, huh?
Yeah, I feel like he's, celebrity therapist though. So I'm trying that track. It's like the woman on TV who does the couples show. Have you seen that couples therapy show? She has a beautiful office in Manhattan. I suspect the network probably pays for it, but
right.
Yeah, so I love this question because I think realistically what happens for a lot of people is always outside of the therapy session. So I thought about this when I read it in an interesting way. I have a lot of clients that come in with notes on their phone for me. So it's like, this is the stuff that's been happening. This is the stuff I wanted to talk about, or this is the revelation I had outside of session. So an interesting way of pushing things forward might be their phone app, their notes app, or they're on a walk with the dog and this thing comes in their head, or they leave themselves voice notes. Like, these are things real people do, I think, when they have these things they want to process with me. Or we've talked about something in session and they have the actual sort of aha moment outside of session. A lot of times they're either writing it down, they have a journal, they have a phone notes app, they have a voice note, that kind of thing. Sometimes too, they'll have conversations with someone else and realize things we've talked about in session. They'll be either in a conflict or just in a conversation. And so that internal monologue of like, oh, I see what's happening. We talked about this and this is something that could go forward.
Right.
I think memories, a lot of times my clients will have memories of childhood outside of our sessions, and they'll come back and be like, that thing we talked about triggered a dream or a memory or whatever. If they're,
oh, dreams, memories. That's good. Internalization.
Yeah. The internal monologue is a big one because I think many of my clients have those realizations outside of my office. And then they come back into me and be like, you know what I was thinking when I was driving to work or in the shower or all the same places you think of things to write. People are having those connections are being made. I do a type of therapy called EMDR, which is a neural processing thing. And very often.
With your eyes, right?
Yeah, it's called you move your fingers. Yeah, I use little tappers too, so it can be just bilateral stimulation. But often what will happen is things will come up in session that kind of don't make any sense. And then you go home and you have a dream or you're thinking about it in the shower or something, and the connection is made. So it's like, oh, this popped up because of this, or I thought of this. Do you think that has anything to do with what we were doing? And then we're able to take the memory and make it make sense in their heads. So there's a lot that happens outside of session that could further somebody's story.
Love it.
So are there resources, techniques, or insights for authentically capturing the internal dialogue or thoughts experiencing these specific mental health conditions? You mentioned internalization and maybe making notes for yourselves.
There's now so many people who do like a journal prompt, like somebody's talk and they're mental health focused. It's not necessarily writing focused anymore. I know lots of people who do tarot and like wish card, I don't know what they're called, the other types of cards that you can pull that tell you this is the thing you're supposed to do today, an affirmation, something like that, that will trigger some sort of revelation or insight or something like that that can get them going. So I think people are doing things through the day, both purposefully and not purposefully. Like you're walking your dog, you're not thinking you're going to have some great insight, but sometimes it can happen. Or you're plugged into a podcast during a walk and you hear somebody say something that you relate to that moves you in that direction too. And then they're bringing them into session on a phone note or a voice note. I had one client one time who used to walk around as if she was on a phone call and just talk into her own voice notes, like verbally processing what she needed to be talking about. She would do it herself into her phone. Yeah. So as she said, so I didn't look crazy, but I was talking to myself. Yeah.
It's so interesting hearing that interaction between the therapist and the client, or the person who maybe is your main character or a secondary character. Is there anything that you feel like we should know as writers about therapists or the therapy session or the medication or some kind of support systems that are in place?
Yeah.
We obviously want to go research, but is there anything that you can think of that you think we should know as writers about?
Yeah, I think one of the things is that the medicine and the therapy are often very, not only separate, but very separate from one another. So I'm not a medical doctor, so I actually can't even really speak to medication, ethically, legally, all of that stuff. That said, I'm wholly aware of all the medicine my patients are on. We talk about how it's working, things like that. And if I'm lucky enough, I can dialogue with their psychiatrist. I think it's also important to know not everybody has a psychiatrist. They're getting pills from their GP. They're getting pills from a pediatrician sometimes. They're getting pills from a neurologist if it's an ADD or something like that. And so that's a frustration of mine as a therapist, is that the medical model is still very like doctor medicine based. And so even some of the best psychiatrists I know, they only spend 10 to 15 minutes with people because they're basically just refilling the prescription. And so I think that's important to know, that those two things don't go together all the time. It's a very rare bird that you find a psychiatrist who will sit and talk to people for a very long time. It's a beautiful thing when it happens, but it doesn't happen very often. And psychologists, the other thing I think that might be important to know is that we run the gamut. So I have a doctorate in psychology, but I don't practice as a clinical psychologist because a lot of that work is testing and assessing and moving on. And that was not what I ever wanted to get into. I wanted to sit with people and work with people and do that. I got trained as a trauma therapist. Not everybody's trained as a trauma therapist, so they don't have that background. They're a lot more of like, let me look at the DSM and diagnose you with something and treat you accordingly. And that's just never been my approach because of the background that I came from. So I think that's something to maybe note that might be valuable in writing, is that there's just a wide gamut of professionals in this, and none of them are right or wrong. It's just a personal thing. And quite honestly, the most important part, I think, in healing is, do you relate and or honor your therapist? Like, is there a, not honor, but you know what I mean? Is that relationship solid? And
yeah,
you know, an interesting thing maybe to write about is how hard the therapist has to work not to let any of that in and not to transfer anything over, and how risky it is on the side of the patient too. You know, I work with moms and I am a mom. And so it's really hard not to just be like, come on, sister, and bring them in for a hug and relate to them on a maternal side rather than as their mental health professional. It's a boundary that I need to walk on the daily. And again, my heart is giant. And so it's hard for me to not just want to hug them and hold them, but manage professionally to metaphorically hold that space for them too.
Right.
In addition, they're in the world now, we've sort of exploded into this world of coaches and that kind of guidance. That's really different than what I do, in that I don't offer advice. I don't tell people, as much as they ask, I don't tell people what to do. And I know, sitting on the other side of the couch, I know that sometimes I really just wish my therapist would tell me what to do. But that's not our job. And so understanding that every single session with a different person, it's never going to look the same. My 10 sessions a day look 10 different ways. And the woman next door to me, they look 10 different ways. It just depends on the dynamic between the people and how you're trained and where your focus comes from and how it works. So there's a lot more nuance to mental health than people know. And I think there's a lot of change that's come in the last 10 to 15 years because women are standing up and demanding that they be treated the way they should be treated and not as just an extension of all the research and study done on men. And so things are different than they were even 10 years ago in the mental health field. And it's mostly good, but it's a different journey. You know, you talk about Freud, who is not exactly the most female focused guy. And all the research. I mean, I remember when I did all the research for postpartum or perinatal mental health, first of all, there's not a lot of it done in the United States. And there is so little of it done in general, except for the last 15 to 20 years, because so much of our research was based on men. And so there wasn't a lot of maternal mental health research out there. So we're new in the field, as with everything.
So are there any last tips you can give our listeners about how they can learn more about you and your resources, and just ways to connect to see what Wonder does?
Yeah, sure. The easiest thing is my email and my website. Those are always a gimme. It's just critzking@wonderinkwellness.com or wonderinkwellness.com. But I'm also on Instagram and TikTok and YouTube. My podcast, I Wonder, is also posted on YouTube. And then I do some other things on YouTube, like book recs and things like that. Yeah, that's a little place for me to be a little less therapy doctor and a little more human being.
Good for you.
Yeah.
Well, that's great. And we will, for those of you listening, don't worry. This will be in the show notes, so don't panic and veer off the road or something while you're driving. So thank you so much, Cristie, for being with us and just being vulnerable about your experiences. And we're just very grateful for you.
Thank you. I love what you guys are doing. It's amazing. So thanks. Oh, I will add one more thing. Sorry, I forgot to say this before. I don't know if you want to cut it in or out. Or in 2025, I had run a group last year called Women of Wonder, which is exactly what it sounds like. It's a support group, a community, a place where you can meet and share with one another. And I'm going to start that up again in 2025. So if you email me, I can put you on the wait list for that as well.
Okay, perfect. Thank you.
Wonderful.
Sure.
Thank you for joining us on this episode of Wayward Writers.
Let's connect. Find us at waywardwriters.com, X, Instagram, YouTube, and Facebook.
See you next time. Conquer your path.